Tutu. Yes, she is a public health physician specialist. We're talking hypertension among market women, and it's based on some works that has been done by Knoxxi Health. If the name Michael Amankwa, like I said, rings a bell, he's the man who is climbing the mountains. Good morning, boss.
Good morning, sir. How are you?
Yeah, I'm all right. So that is the other side of Don Miller, right? Don Miller is the founder of Knoxxi Health. So let's start with the inspiration behind Knoxxi Health. How did this come about, and what is Knoxxi Health in the first place? And I hope I'm even pronouncing it well.
Yeah, it's correct. It's correct. Yeah. So good morning to your listeners and viewers out there. And yeah, so Knoxxi Health primarily got started, a couple of years back. I think about 3 years ago, and it was birthed from, during the COVID era, when I had two of my very good friends that I normally would go visit after work, and we'll just, chill and have conversations. And the two friends passed, and when they passed, it made me reflect on life. And when I turned 50 as well, I looked at the first 50 years and then asked myself, if God has given us 70, I have 20 more to live. What do I want to do? And at that point, I realized that what was most important is one's physical health and mental health. And primarily, and the more I thought about it, the more I realized that quite a lot of us have gotten the life script wrong, because we primarily focus on wealth and money and the good living and the status at the neglect of our physical health and mental health. And the more I delve into it, I realized that, it was a bigger problem, not just in Ghana, but across the world, primarily because most of us do not know our state of health at any point in time. We only know that if we get to do our physicals, annually or semi-annually, but what happens in between? And that is what birthed Knoxxi Health.
Oh, okay. And so what is Knoxxi Health?
So Knoxxi Health is it's a health technology company, and we provide health monitoring solutions. So what we do is we help you monitor your vital signs on a regular basis, and then we're able to provide insights and information so that way we are able to detect any anomalies or any challenges before it becomes serious or it gets to the chronic state.
Oh, wow. So what are we buying from you? Is it a service, or we're buying hardware, or we're buying what is...
So it's a technology platform, and what you get is obviously, we have different packages. So you can have the free package, or you can have the subscription-based package. But what it does is that it allows you to enter or capture your vital signs. So you can, quite a number of people check their BPs in the morning, in the evening, they have to check their sugar levels and all of that, right? So the platform is a technology platform which allows you to capture those readings. And the more you capture them, the system actually gives you real-time interpretation, and then also does insights or analysis for you. So that way it's able to tell you whether you are getting good, you're getting bad, or you are stagnant.
Okay, and we told you did some work with market women at Mallam. What was that study about, and what were some of the findings? Yeah,
so after we wanted to validate the technology solution we had developed, and we wanted a controlled population to work with. So I reached out to this insanely great, super smart, forward-thinking doctor friend of mine, who was seated on the right side of mine.
Okay.
Valarie Osei Tutu, and she's the director for Ablekuma North, and Mallam Market was there, so she offered Mallam Market. So we went in there. The first thing we did was to do a survey, of the market folks to find out whether, they knew their state of health, because that's what we're trying to validate. And when we did it, about 79% said they didn't have any blood pressure issues and the like. So that was the survey from them. And then, but when we started collecting the data, that is actually, so what we did, we had nurses going there on a daily basis, and we were checking their vital signs, which was primarily their BP, their sugar, their blood oxygen, their body temperature, and all of this were being captured, digitally, real time. So as we're analyzing it, we realized that the story was totally different. It was the opposite. About 80% plus of them had BP issues. And some of them largely were walking dead. And it was so alarming. It was so alarming. And we've done that for about 4 months now. I think we're in our 4th month. And I must say that it's been life-saving.
Wow. They didn't know. And so they were going to work every day, eating the same food, Same lifestyle.
The same lifestyle, sitting there, sedentary life. And you know what's interesting? It's not even just about, we talk about the Mallam woman because that's where we've done the pilot, but even professionals, people sitting in the offices, the young folks, a lot of them are currently challenged because when you don't monitor, you don't know. So imagine, I know you have a very beautiful Bugatti or Ferrari that you drive, Jerry. And imagine, for a minute, it's like, I'm sure you were wondering, where's Michael going? Yeah. So imagine your car does not have a dashboard. Yeah. You're not able to tell how fast you're moving. You're not able to tell how much fuel you have. You're not able to actually, get any of the alerts that, your dashboard gives you. Where are you going? You're open to so many challenges. It's the same way we live our lives. We live our lives as if we don't have a dashboard. So we're just living, we're just existing. And then if you're not lucky, life just surprises you with some illness, and you either pop or you get into a chronic state, and then now you have to be medicated for the rest of your life.
And Knoxxi is the
dashboard. Knoxxi is the dashboard. It helps you know. For example, you're taking medication, but how do you really know if the medicine is working? Today, a lot of people are on medications for life. But how do you really know that it's working? How do you really know that the medication has to be altered or changed or whatever for you? Today, most of us don't know. And that's what Knoxxi does.
Interesting. Let's come to Doc. Doc, this finding, and you coming in from the Ablekuma North, in fact, Ablekuma North, your results have been declared. Your results are part of the 4 that the EC said is illegally declared. So, I mean, was that a surprise? Was the finding shocking to you? Or was it more like, we've known this always, we just needed the facts?
No, we didn't know this.
Oh, wow.
And like everything, we needed data to help us. So we all know that, yes, women in the market have sedentary lifestyles. So obviously they are high risk for getting hypertension. But we didn't know it was this serious, where we had almost 80% of them coming up with hypertension, yes. So this is basically, it's a serious concern, public health concern that needs to be addressed.
But what does this say about the broader public health landscape in this country?
Yes, so it shows us that there's more to it than we're actually seeing. Initially, we went in there, they said they didn't have. We did the test and realized that a lot of them have. So it means that a lot of people are living with hypertension, either undiagnosed or they're just not controlled, so uncontrolled as well. Hypertension, we know that is a risk factor for developing all these, renal diseases, or let's say kidney diseases, stroke and the likes. So it is a concern, because then it means that we'll have to increase awareness among these women. We need to make sure that we link them to care, and as well as making sure that they are on their medications when giving.
I mean, for me, when I read about this project and what the two did together, I saw it more like a beautiful PPP sort of, like government, private sector coming together to do something very exciting for the people of this country. So now the facts are there.
Yes.
Private sector has shown us, they're giving us the fact. We know. What next? What next for a project like this?
Okay, so for my level, I would say that what we did was to bring care to them. So it was very difficult trying to refer them to the doctors, because then most of them said they weren't going to get up and go. So what Michael and I did was to bring in a doctor, a medical doctor, to see them. And that's something that he wants to add to the project.
In the market?
Yes, in the market. So we set it up. 2 doctors came in, and then they saw these patients, let me say clients, sorry. So they saw them, gave them any vital information they needed, put them on medications, because there's a medical doctor. And then that was it. So it's supposed to be done every month. So we are hoping this will help, where we are bringing the services to them. At the same time, too, we have our health promotion people who go around and educate them, raise awareness on hypertension, and then the need for taking in your medications. Another thing that Michael and I wanted to do was peer support.
I mean.
So we're talking about the peer support.
Okay.
You know how difficult it is. Hypertension is a chronic disease. I mean, there are times that you get bored that you'd have to take medications every day of your life. So we believe that connecting people to others, like their peers who are probably well controlled or compliant, will help. So that we haven't done yet, but we are hoping to do that. Yes.
Wow. Who is paying for the treatment?
The treatment. So when we took we got the 2 doctors in, as doctor said. He checked them and all of that, and then some of them were referred to like next level care. They have to do labs and the like. And then some of them had to be put on medication, so they got the medication. I think some of them also have access to national health insurance, so they were gonna use that. But what we are doing is primarily not for profit per se. We are not a non-profit as well, but it's just a way to take care to the people. We realize that look, if care is not taken to them, it's just, and these are people who can be our mothers, our aunties, our people's wives and the like, and they need to be taken care of, right? And the sad part is this: a lot of the people in the market are being scammed. So you have individuals who just go in there, they say hold this device, and they give you a full diagnosis, or they check your BP and they tell you your cholesterol level is high. So and they give them medications, and these are people who are scamming them, which is now affecting the market women by virtue of they now having kidney issues and the like. So what we do is, the model is that we when we go in there, we see a market, a client once a week. So even though we're in the market on a weekly basis, we see a client once a week. So in a month, we see you 4 times. And you get what I'm talking about, we see you 4 times. And all of this, the data is being captured. So real time, the dashboard is there for all key stakeholders. So Ablekumano, the directorate, doctor and her team are able to analyze and see it real time as things are changing. So if there has to be a reinforcement goes in there. If it's education, it goes in there. So we did breast cancer screening for them. The few that had, some challenges that were discovered, we connected them to Eurocare, and then they went to do free mammograms. We have eye care coming in there to also come and help them with their sight, right? But these are things that primarily, Knoxxi funded, and then Ablekumano also supported with their their weight. But going forward, clearly, it's a model the model that we know is going to work, and we need to roll it out nationwide if we really want to change. And here's the thing: look, if you're unwell, there's no way you can be productive.
No,
you cannot be optimally productive, and that's what's happening. Because the moment you're medicated, you're going to be drowsy, you're going to be woozy, you're going to be lethargic.
Which is why they didn't even want to get out from the West.
No. I mean, look, it is that serious, and I want to bring the attention. It's not just the market folks. It's not just the market folks. We did a random one at UPSA. There was a conference there. We did a random one there, bro. It was that alarming. It was very, very alarming.
I'm not too surprised. I mean, I did one quite not too long ago, and mine was scary. I mean, these things. So, long-term sustainability, we're looking at financing. Is this something you're expecting government to come in at a point? Because there's only so much that Knoxxi Health can do.
I think, you see, and it's been designed in a way that it's really not that expensive per se.
Okay.
Right? So one, in the market, we take, a meager 15 cedis per visit.
Okay.
Which does not really cover the cost of, because we are talking about nurses, trained professionals who are going in there seeing this woman on a daily basis, right? So that's
quite
one.
Expensive.
Yes, that's one. And the other side of it, which we need to talk about, is the employment creation, the job creation. So as we speak, we are looking at between the next 7.5 to 8 years to have 100,000 human agents on the ground, health agents. So we're talking about what? Employment, job creation.
You never do anything small.
No, I can't do that, man.
Yeah, because, I mean, this. I was expecting you to mention some figure.
No, if you want impact, look, it's got to be huge, right? It's got to be huge. But we've proven that it works.
Okay.
For example, we just last week or so I think about last week or a couple of days back, we got DBG, Development Bank of Ghana, come in there and also support. We got My Life insurance. They also came in to support. So the plan is being unveiled. So it's all about all hands on deck.
Okay.
It's all about all hands on deck. And here's what is most interesting. When we engage the clients and we tell them that, oh, Charlie, your pressure, and it's serious and all of that, the initial thing they do is they're in denial.
Of course.
But then what happens later, and the moment you start paying attention, you realize that they become quiet. They now start thinking. Then some of them will say, oh, I didn't sleep well. Oh, I didn't eat well. Oh, today I've not prayed. So they try to come up with excuses. But later you realize that they start to think, and then they'll invite you over, and then they want more information. So they are desirous. They're hungry for assistance.
Okay.
It's about how we take the assistance to them. And I really want to applaud what Doctor has done. I mean, all jokes aside, I had spoken to quite a number of other doctors, but the moment she heard about what we're trying to do, she would not even let me rest or sleep. She said, Michael, this is innovative. This is something that we need. And truly, look, it unveiled the true situation. And not only the situation, but how do we solve it going forward? And the more, and here's the interesting thing, the ones that were rushed to care, that went to care, they were detained.
Oh, wow.
Yes, they were working dead. 255 over 190 something things. It's like they were detained. And then afterwards, bro, 1 a.m., 2 a.m., they are calling me, God bless you, God bless you. And now they are calling me doctor. I'm not a doctor. You know, they were saved. Yeah. They were saved.
I mean, if one of the things I've also said, Doc, is that probably NCDs and their other cousins who are not but they are very serious, communicable diseases. I think that thing is, there is always a fight as to who gets attention, and because attention then results in resources going to that direction. Because from what we're saying, these are killers, killing our people by the minute. However, COVID got all the attention. AIDS, at a point, on decade or more ago, got all the attention. Ebola comes in, then it takes all the attention. Meanwhile, these ones are. How do we solve this fight between NCDs and their not two cousins?
Okay, so I'd want to speak that these days we realize that NCDs have become very important. Mm-hmm. So, yes, Ghana is taking it seriously. And one thing I know we're targeting is preventive care. So with the Ghana Health Service, we have what we call wellness clinics. So wellness clinics, as the name suggests, wellness. You're well. You don't have to be ill to get in there. So you're getting there when you're feeling okay, and then you get your vitals checked.
Happening here in Ghana here?
Yes. So we have some of our big hospitals, like Ridge Hospital, 37. And then we have a new polyclinic that we have a room for wellness clinic as well. So basically, Knoxxi was like a wellness for us, like a screening to a wellness thing where you're going in there, the person hasn't really said there's anything wrong with them, but you're going in there to check. And then boom, you find things out.
Okay.
So it's something that I know is one of the things that we are doing as a country to sort of find out people who have these diseases. So yes.
So Knoxxi becomes like a wellness clinic in the palm of your hand.
The platform.
Yes.
Yeah. What are the things that I need to put in if I want to be? If someone listening to us said, "Okay, I didn't feel well this morning. I want to try this." What does the person have to do?
So here's where it gets interesting. We have millions of folks, Ghanaians already, who are hypertensive, who are checking their BP in the morning, in the evening. Those who are diabetic are checking their sugar levels and all of it. They're already doing that. But if you take the case of the BP guys, quite a number of them will write it down in books or on paper and all of that. But here's the thing. I personally have a family member who has to do that for 3 months and then go see their doctor. So if you're doing morning, evening, that's 90 times 2 is what, 180. Yes, so 180 records. There's no way the doctor that you are going to see for review will ever analyze that 180 records and tell you, okay, this is your average BP, and then when they are spiked, there's no way he's going to do that. But instead of right now writing them on paper, you can now log them on the Knoxxi software platform, right? So as you log it, instantly it gives you feedback. And it's also analyzing your logs. So the moment it starts spiking, it notifies you, alert you that guy, you are spiking. So in terms of, we are not changing lifestyles, we are not changing the way people do things per se, we are just enhancing it. So instead of you just writing down on paper or not writing at all, because people are checking, and a lot of them, one time I took an hour off, I went to place myself in a pharmacy. I was there, more than 15 to 17 people came to check their BP for free. But you know what, afterwards, it was written down on a piece of paper for them. Now, what happens if that piece of paper is missing? How do you get to analyze that data? What we've done now is to elevate that, because people are already doing it, but how do we get them to do it smartly, whereby they're able to get the most, and timely information? So
somebody logs on to your website.
Yeah, Knoxxi. So Knoxxi.com. The iOS just got released 3 days ago. The Android will be out probably this week.
Okay. So you go there,
you create an account. You create an account. Then obviously you need to have your apparatus, right? You have to have your own BP monitor, or you've gone somewhere. So let's say if you've gone to the hospital, the first thing they do is to check your vital signs.
Yeah.
So when they check it for you, you can ask them, okay, what is my BP? What is my blood oxygen? Then now you can log it on to Knoxxi.
Okay.
You get it. So if you have the own apparatus at home, or you can do that. And let me tell you everything that we do as a company, as Knoxxi. Every day, every employee that walks through the gates, who comes in there, everybody's vitals are checked. Every day. If you're a visitor, you come to Knoxxi Health, your vitals are checked for you. So right now as we speak, we have an idea as to the aggregate health of our employees. What percentage of our staff are what? Obese, overweight. What percentage of them have hypertension challenges? What percentage of them are overweight, right? And we also capture mental health information. So when you come in, there's 3 simple things we ask you every day. How are you feeling today? Great. Okay, not great. Now, the moment you start putting all of that information together, you start seeing a picture. So if your listeners, and I know there's a corporate, you have a lot of corporate listeners, every organization, yes, it's okay to give your employees health insurance, but let's not wait till where they have to go and use the health insurance. At that point, it's almost too late. But let them be checking, right? So as a company, you need to know, like Zed, you need to know what is the state of, health of my employees, not individually, but, from an aggregate perspective, yeah? So that way you can custom tailor solutions to them. Maybe you need dietitians to come in and talk to them. Maybe you need to incentivize your employees to be more physically active, right? But today, what most companies do is they just give you that, or once a while, or in a year, they'll do an annual walk, health walk, or whatever. No, we need to change the narrative and the way we do things. Let's keep on checking those vital signs, because that is how we detect any challenge that is brewing.
And so a corporate body listening to us, maybe a chief executive listening to us, wants to reach out to Knoxxi. What is Knoxxi going to do? Set up a system in their offices so that every staff is checked before they come?
Brilliant question. So what we do is this. I mean, once we do the contractual, whatever, have all of the discussion, the understanding and all of that, then now we sign them on to what we call a Knoxxi corporate. Okay?
Oh, okay.
Now we have nurses who come to your corporate office or your branch or wherever it is once a week and take the vitals, for your staff. You understand? And once they take those vitals, so let's say we've come to Zed, okay? We are down there, or they've given us a small room, then your staff will come one by one, they check their BP, check their body temperature, their oxygen, and then do their sugar for them. That information is logged, okay? And then there's serious privacy. It's all secure, encrypted, in transit, on storage. You can request to have your account deleted. All of those things are done. We are data protection certified. All of those things are taken care of. So now we will have a nurse come to your premise once a week and take the vitals for your staff.
Okay, so if Zed Multimedia is interested, we would partner with Knoxxi, because DJ P2 and some of the technical guys,
it's very important.
They need to be checked.
It's very, very important.
Victor Ado especially.
Yes, and Youngson, where's my friend?
Yeah, we spoke about him. Kweku definitely.
But I see him on Legon campus. He comes to work a lot.
Yeah, these days he's taking.
He's been very consistent. I want to applaud him on that. Kweku, Charlie, keep it up, bro.
Yeah. So I mean, moving forward, so we've seen a pilot work. Now the idea is to blow this thing up. We don't have a lot of Dr. Valaries in town. You might get 2 or 3 more. How do we ensure that this goes beyond the goodwill of a Dr. Valarie and make sure this becomes systematic and we roll it out? What are the plans?
That's very good. So we've finished. We are still we don't just go to a market and leave. We are staying there as permanent. So, so the Mallam Market, we are there. We are staying there. The next market that we're activating is Medina. So we've gotten all the approvals and all of the agents are on standby. Just because of the season, it doesn't make sense for us to go and start checking vitals when the people are trying to sell and make money. Yeah. So right after the holidays in January, Medina also gets activated. Then from there we do Mokola, then we start rolling. Now the beautiful thing is that through the support of what Dr. Valarie is doing, the message is also getting out there. Some of her colleagues are reaching out to her and saying, you know what, we like what you guys are doing. We want to see how we can. And I really want to acknowledge and applaud Dr. Valarie, because, look,
she opened the door.
She opened it. Not just open. People can open doors for you.
And she kept it open.
But she was there. She was in the market. And look, bro, if you're in the market, it's not easy.
I know.
The humidity, the stench,
the mud under your feet.
Charlie, sometimes it's raining and all of that. And her expensive dress, when she's in her shoes, you see that Charlie's all muddy and things. I'm like, Charlie, this is what we have to see how we sort it out later, we joke about it. But she was there, passionately engaging them, talking to them, encouraging them. Sometimes she will even go out. Look, she extended herself. So I will say that, look, this was successful primarily because what? God gave us an angel. God brought us an angel, which is Dr. Valarie.
Because in this country, a lot of good stuff get frustrated because of
Yes.
People, yeah. So
Yeah.
I can appreciate.
And then when it's health, people don't want to know. They prefer not to know. And I'm like,
yeah, but we could die. So.
they don't want to know. But Charlie, die smart. Know that you are dying. So like, Charlie, whatever you have left, you know how to live it. Yeah.
Yeah.
Yes.
Yeah. It is true. So I like the fact that beyond Mallam Market, we're sending this thing out there. So when we look at the system now, we're told that the NCDs are actually becoming more dangerous than the loud ones. And I call them the loud ones because COVID proved that they can be very loud. There's studies that show that along the way more might come, more deadlier ones and all that. We pray they don't, not in our lifetime or in those of our descendants, but you never know. What should we as a nation be doing now concerning NCDs? Then later I'll come to tech and health. But what should we do? I mean, from where you sit, what are we not doing? What should we do?
Okay, so the nation, we have the NCD policy.
Oh, okay.
Which is based on, obviously, research. So research was there and it's informed us to get the policy. So the policy, one of the things is to reduce the risk factors. So that's why we have a lot of education and awareness creation going around. We have a lot of screening exercises in our wellness clinics as well. And as part of the NCD policies, we also have the multi-sectorial collaboration, which is what you've seen us doing now with Knoxxi.
Okay.
So it's all part of the NCD policy. We are following NCD policies. As the director, I need to implement these policies. So that's how I do it. And
you're lucky to have
Knoxxi as well. So it's not just
coming.
about me. He also helped me. Knoxxi also helped me. So thank you, Michael, and thank you, Knoxxi.
yeah. I mean, if he's your friend, you're in trouble. I mean, he pushes you to.
He
the,
does.
Yeah. So now she's swimming and gymming.
That was my word.
Yeah.
Actually, that one I need to call you.
Yeah, I know. Charlie,
Yeah,
no, I will get you this weekend. You see the thing we do this weekend.
I saw it.
Yeah. You see,
saw
and
it.
here's the thing for those who are, listening. This weekend, we went to Afajato region. Yeah, we ran 15 kilometers. We came back, climbed the mountain, which is Mount Afaja, the highest mountain in West Africa, 885 meters, then cycled 75 kilometers. Now, why is this possible? It's possible because we are conscious of our health, which has enabled us to stay fit. Now, when you are fit, there is nothing you can't do. And that's what we just demonstrated.
Yeah, I saw it. I didn't join you.
Yes. But very soon, don't worry, we go. I get plan for you. So
yeah, I mean, and especially when you then came to post that the bus
broke down.
I said, it's sweet. Good give them. They know their house.
But you know what's interesting? Before, because that's all like my stuff, and that's what I do as a CEO and as a leader, and knowing the benefit of being physically and mentally solid. Yeah, I got all my team, all of them to come. Before they were, I don't want to come. That I don't. I said, guys, it's not negotiable.
Exactly.
Now, when they came, you should see them after they had submitted and they came down, how they felt. They're like, oh, there's nothing I can't do. Oh my goodness, I learned this, that. And I say, yes.
Yeah.
This is the lifestyle that we need to be talking about. We need to be active. We need to be mindful. We need to be intentional. We can't play Russian roulette with our health. It's not like a car that you can overhaul or change the engine. If your kidney is gone, your lungs are gone, and your heart is not functioning, Charlie, you're not in a good place.
It's true.
We are not. You see, we talk about these things, but look, we are not serious about them. We talk about it, it's like a passing conversation. But we have to be super serious about them.
I mean, I am interested in the Knoxxi thing and all that that you're doing, because I think we've not treated health the way we're supposed to as a people. Either we're too secretive about it, so we don't even want to know, like you said. And then also another angle, which I would always say I'm as guilty as charged this, then we put it all on God.
Yes. That part was huge in the market.
I was going to ask that.
That was huge.
Did you find that as one of the biggest challenges?
Plenty. You see, but then the way you defeat that is with the information. Because the moment you start showing the person that this is your true picture, oh God. Then the person, they start waking up. So you have people wake up like super fast, then those who will come slow. But you start realizing, and in the market, when you go, someone else, me check it. But the moment you check some of their colleagues, the next thing you realize that they will call you. So so they all get interested, but at different stages.
Yeah.
You get it. And Charlie, look, and I always say that this, I mean, and I hope nobody will punish me for it. Taking medication is not sexy.
No.
So don't even wait to get to that point. If you have to, then that means that's truly your last resort.
Yeah.
But today, a lot of people just think that, oh, okay, let me allow myself to go and I'll be on medication. But it also has its own side effects.
It's true. So God will do it, but then God also giving you...
you have to do your part.
You have to do your part. Technology, our adoption of technology is not as high there as it's supposed to be. Did you face those challenges when it came to this whole thing? Are the market women also logging in and putting in their data? How do we blend this technology adoption?
So one of the things we did was, during the survey, we wanted to know what percentage of them, were technology savvy, what percentage had smartphones and all of those things. We collected the data. Largely for the market folks, they like to be pampered. So they like they like the interaction with the nurse. Because when the nurse is with them, it's not just about, they get to talk about different things, and this people, they crave love. They crave attention. They crave belonging, and all of that. So as much as some of them are technology savvy, they prefer that human touch connection bit, because they get to talk to them about other issues. Some of them will talk about their marital issues at home, issues with their children and all of that, which is important because that's what, the community health nurses are supposed to go in there and engage them and, help them and things like that. So outside of them, we've gotten a few of them. What they do is that they'll ask you for information.
Okay.
And with Knoxxi Health, what it means is that now you can actually get your data and give it to your healthcare professional.
Okay.
You get it. So they can. So now, for example, if you've left Accra, you've gone to Tamale, something's happened to you, you can actually share your vital signs over a period, 6 months, 1 year, and all of that, for that person to have an idea as to your state, so that they can properly service you.
How expensive is this if for anybody listening? Forget the market woman. The average you listening to us. What are the packages? What should I do?
Yeah. So I mean, the beautiful thing about what we are doing is that it's not just a Ghanaian solution; it's a global solution. And Knoxxi Health is a US-based company with a subsidiary in Ghana, which is the Knoxxi Health Ghana Limited. So we have the free the free package, which means that people can still use it to log their vitals for free. Certain advanced features, obviously, you have to pay for. So we are looking at $1.99 for the bottom tier, $4.99
per month.
Yeah, per month. I mean, look, these things are tokens, honestly. I mean, given the benefit you get. And also, this thing is using serious artificial intelligence. So our ultimate goal is to be able to predict, so that we should be able to tell Jerry that in the next 48 hours, Jerry, you're going to be sick before you get there. We want to be able to say that this young man here, in the next 5 years, if he doesn't change his lifestyle, he's going to be hypertensive or he's going to be diabetic.
I'm happy you're talking to him. That's the way he's like. Yeah. Prince is like that. Yeah, so it's good you're telling him.
Are you me? So that's our ultimate goal, is to be able to anticipate before it happens. So that way you are warned. That's where we are headed. And to be able to do that, you need the data.
Okay.
You need the data.
So listeners, please, you can check them out where?
Knoxxi.com. Knoxxi. KNOXXI.com. Yes. .com.
Okay, so you want to check them out. It's important that you do. Your health is your wealth. So this is a question that just came to mind. One of the big things the president wants to do, the president-elect, is to set up a women's World Bank, specifically for women like the ones you are getting their vitals. Would there not be an exciting collaboration if we add this bit to?
I love your question, and that's what DBG, Development Bank of Ghana, did with us. They came into the market with us, and then they supported the market women. But here's the thing: why are the people in the market? They're in the market to do what? To make ends meet, to make money.
Yeah.
But what is most important is when they make those little tokens, those monies here, they later go and spend it on healthcare. So it's called zero. So now what we need to do is to really look at how we do our products. Combine the health with the financial solutions.
Exactly.
So as you are doing their daily susu, you are collecting their vitals along.
Brilliant.
Are you getting what we're talking about? Yes. And the interesting thing too is this: in the market, the women were more concerned about their health than the men.
Yeah.
It was very interesting. The men, because, even though about 90 something, well over 90%, 90 something percent were women, we still got a good chunk, about 8% were men.
There, yeah.
But the men were not keen on, it was interesting, yeah? And some of them were more interested in like prostate cancer. But that one, when you talk to them, they're like, Charlie, look, maybe my thing no go work again, so I don't want to know, you know.
Yeah.
But then, so there's a need for education. And that's where the Knoxxi platform also comes, because on a daily basis, on a weekly basis, you can be getting personalized health information tailored to your situation.
It's Knoxxi Health. We've been talking to Mr. Michael Amankwa, the founder and CEO of Knoxxi Health Ghana, and then also Dr. Valarie Osei Tutu. She is a public health physician specialist from Ablekuma North. Their results are yet to be declared by the EC. We give you the last word, Mr. Michael Amankwa, before we take leave of you. What would you want Ghanaians this morning? It's 9:31, 16 December. If you have a message for Ghana, 9 days before Christmas.
The function of life is not to exist, but to live. And to live, you have to be intentional about it. And to be intentional about it, it has to be grounded on two key things. Your physical health and your mental health is non-negotiable. At any point in time, seek inner peace and happiness. When you do, and you take care of your physical and mental health, the rest follow. You can make all the money you want in the world sustainably and consistently. Do not wait till 31st December and say you want to do New Year resolution. Start early morning walks tomorrow. Start early morning walks tomorrow. Jerry, start early morning walks tomorrow. Jerry, start early morning walks tomorrow. Thank you very much.
Thank you very much, Mr. Michael Amankwa and Dr. Valarie Osei Tutu for coming through. Coming up, we're talking to Mr. Joe Jackson about economy. But, you know, his name is Don Miller. He's my boss. What else can I say? It's still BBC Business Breakfast on Zed, right here on Zed 101.9 FM.